The preaxial vein of the upper limb, which we call it as encephalic vein, it receives a small tributary from the external jugular vein. Okay, so uh, the external jugular vein, it is supplies the tissues of the neck through this cephalic vein. So in the early stages of a development, what happens? The cephalic vein it disappears. The early stage of a development. So in that case, instead of developing into the anterior and posterior division of the retromandibular vein, only the undivided retromandibular vein is formed. So here the entire retromandibular vein it unites with the posterior auricular vein. So the retromandibular vein it continues downwards as the facial vein below the angle of the mandible, and it continues downwards at the middle of the posterior border of the sternocleidomastoid as an posterior auricular vein. Now, the posterior auricular vein it bifurcates into the medial and the lateral division. So this medial division it receives the common vein from the anterior jugular vein and the anonymous veins. Finally, the medial division it terminates into the internal jugular vein. Whereas if you're seeing the lateral division, it receives the common vein from the suprascapular and the transcervical veins. So finally, it terminates into the subclavian vein. So hope you understand. Actually, the normal formation is there is a division of the anterior and the posterior division of the retromandibular vein. Okay, but here in your case, what happens? The preaxial vein of the upper limb, which is a cephalic vein, it receives a small tributary from the external jugular vein. So that cephalic vein, usually at the later stages, it divides the retromandibular vein into the anterior and the posterior division. But here, in the early stages of development itself, the cephalic vein disappears. So, because of the disappearance of the cephalic vein, the retromandibular vein is not divided. The undivided retromandibular vein, it continues as the facial vein below the angle of the mandible, and it continues at the middle of the posterior border of sternocleidomastoid as the posterior auricular vein. Now the posterior auricular vein it divides into medial and lateral division. Medial division receives a common vein from the common facial vein and the anonymous veins, and the anterior jugular vein and the anonymous veins, and terminates into the internal jugular vein. Whereas the lateral division it receives a common vein from the suprascapular vein and the transcervical veins. Finally, the lateral veins it terminates into the subclavian veins.